Hey, welcome to this meeting of the decision session of the Executive Member for Finance and Performance, Monday the 13th of September. Item 1 on the agenda is declarations of interest. I have no interest to declare. Item 2 is the minutes of the previous meeting held on the 21st of July. I get used to signing them properly again rather than saying I'll do them next time I'm in. Just about remember how to write. Item 3 is public participation. We have no members of the public registered to speak today. There will be a slight change to the agenda, so I'm going to go straight to item 5, the application for community right to bid, and ask for an update from officers on that particular item.
We have been contacted by those acting for the owners of the study who are at a late stage with information that we need to consider further. Having discussed this with our legal team, we are advised that the decision session scheduled on this matter be postponed, and we duly request your authority to do so. We'll be reporting this matter for full consideration in due course at a future decision as soon as possible.
Okay, and happy to defer the item, and if you two would to take your leave, move on. And then I'll move on to item 4 on the agenda, which is the health and safety update. I'll hand over to Judy.
Thank you very much, Chair. So the report you've got in front of you is the 2020-2021 outturn report. So we're bringing this back on track regarding reporting. I think you received an update in January, so it's bringing you back for the annual report. Update on the actions being taken to address the risks and key areas of work. So you're asked to note this, note the performance of the shared service, and consider any areas of risk that you want at future sessions. Just taking you on to page 4. I'll just take you through what the report actually goes into, and I'll cover that in a second. Joint Health and Safety Committee, as you're aware, it gets reports back, and the trade unions are also present on that. So everything does go through the Joint Health and Safety Committee. And we have the new BeSafe system is introduced and operational now. And as you're aware, I'm here instead of the Pauline Suchfield, who previously came for health and safety as the head of HR, has taken over responsibility for the health and safety shared service. The analysis at section paragraph 9 takes you through the performance of the shared service, and there's nothing of concern to be raised in its meeting all of its requirements. Taking you on to the report then from page 9 onwards. Obviously, the team in health and safety were dealing with the aftermaths of COVID still. We carried out over 45 visits and inspections across premises, and the team is still advising and guiding premise managers across the council with regards to COVID measures. And obviously, as the advice and guidance changes from government on a regular basis, we obviously provide that advice. We've updated the health and safety policy because of the changes to the senior management structure, and that's a statutory document that has been updated. Taking you on to page 11, the top 5 work-related incidents. We're still there with child under 18 aggression. That's a lot from our beehive area, which is unintentional behavioural issues. They're not a major concern on that. The near misses at the table at 23, just for noting that does cover near misses and damage to property as well. So there was 4 damage to property in that, as well as 19 near misses. And I think the positive bit from that is we're obviously getting more people reporting near misses, which is a change in the culture, which is really good to see. Moving on to table 2, the RIDAR notifiable incidents, ill health conditions. That's the one of them was Wells disease from the flooding in York, COVID related, and DSE. The over 7 days absence, that links to manual handling mainly, so common injuries such as in social care where they're handling members of the public, and the dangerous gas fittings. That's when we've come across previous work really, where previous work in the buildings has not been satisfactory. So again, that's raised. I think taking us on to the kind of the national issues around on page 13 going forward. There's obviously the changes to the Fire Safety Act that's received royal assent and is progressing through. And at 13, we have introduced an enhanced procedure around hot works, and that came in January 2021. So again, I think the work of an awful lot of work has gone on and will continue to go on across the health and safety function. Continued work around COVID. We're bringing in, we've updated the contract for the lone worker devices, so reissuing them. The fire safety strategy is a biggie that's coming through. An increased request to the safety advisory group for the council. And if there's any technical questions, I brought a friend. Thank you.
I'm assuming he's a fellow officer, not just
Yes.
random
Yeah,
friend.
not a random.
Bring anyone just for moral support, just in case. Okay. Just to give my thanks to officers in terms of the work that's been done and the report that we've got in front of us. I think one of the key things about this report is it's never be complimentary to say something's boring, but you don't particularly want an exciting health and safety report because it means it's not going the way we probably want them to do. So sort of the more straightforward it is, probably better for me. And I think the one thing I do keep flagging up, and it is showing up on this report and has been rising, is that impact on staff and the way staff are being treated. And I think that is a particular point of concern. And obviously this highlights children's social care as well, but I know that's starting to come, especially in the climate we're in across most of the areas of the council in terms of frontline services, in terms of our call handling staff and the way things are going. And I know we have discussed previously elsewhere about how we can help to support staff and make sure that they're being treated the way we would expect them to be treated and not the way that they sometimes are. I think that is probably my biggest area of concern in terms of this particular report. So with that one, I'm more than happy to note the recommendations at paragraph 3 on page 3. With that matter, I have no urgent business. Happy to declare the meeting closed.